skeleton is divided into two parts, the appendicular skeleton and the axial skeleton. The appendicular skeleton is 60%, while the remaining 40% is the axial skeleton. The skull is not just one bone, it's a couple of fused bones. The frontal bone, the two parietal bones, the two temporal bones, and the occipital bone. The joints between the skull bones are immovable and are called sutures. The coronal suture, which separates the frontal bone with the two parietal bones. The sagittal suture separates the two parietal bones. The squamous suture, which separates the temporal and parietal bones. And the lambdoid suture, which separates the occipital and the two parietals. The occipital bone External occipital protuberance is a small bump at the midline on the inferior surface. Occipital condyle are site of articulations between the skull and first cervical vertebra. External occipital crest foramen magnum surrounds the connection between the brain and spinal cord in the vertebral canal. Jugular foramen lies between the occipital bone and the temporal bone. The parietal bones articulate with one another, so they are paired bones. The frontal bone. The supraorbital foramen provides passage for blood vessels that supply the eyebrow, eyelids, and frontal sinuses. The frontal sinuses, variable in size and time of appearance, they generally appear after age 6, but some people never develop them. The two temporal bones. Zygomatic process articulates with the temporal process of the zygomatic bone. Mandibular fossa marks the site of the articulations with the mandible. mastoid process is an attachment site for muscles that rotate or extend the head. Styloid process, near the base of the mastoid process, is attached to ligaments that support the hyoid bone. The carotid canal provides passage for the internal carotid artery, a major artery to the brain. Foramen lacrum is a jagged slit extending between the sphenoid and the petrous portion of the temporal bone and containing the auditory tube. Stylomastoid foramen, between mastoid and styloid process. The facial nerve passes through this foramen to control the facial muscles. External acoustic canal. The internal acoustic canal, which carries blood vessels and nerves to the inner ear and conveys the facial nerve to the stylomastoid foramen. The sphenoid bone, which is the bone that looks like a butterfly. The lesser wings extend horizontally anterior to the sella turcica. The greater wings extend laterally from the body and form part of the cranial floor. The sphenoidal spine, which is a part of the greater wings. The sella turcica, a saddle-shaped enclosure on the superior surface of the body. The hypophyseal fossa is the depression within the sella turcica. The pituitary gland occupies this fossa. The sphenoidal sinuses are on either side of the body, inferior to the sella turcica. The foramen ovale. The pterygoid processes, which which are attachment sites for the muscles that move the lower jaw and soft palate. The medial pterygoid plate. The ethmoid bone. The cribriform plate forms the anteromedial floor of the cranium and the roof of the nasal cavity. The olfactory foramina and the cribriform plate permit passage of the olfactory nerves, which provide the sense of smell. Cristagalli.